Watch out for these 9 dangerous bacteria that are harmful to humans. At the beginning of the year, the World Health Organization, WHO, published the list of the most harmful bacteria for humans. Among those published you can find the ones that took the most human lives. Knowing which these are, their symptoms, and associated illnesses is important to maintain your personal and family health. The majority cause common diseases that put lives at risk if we don't treat them. In addition, this list also indicates the need for medical laboratories to find new antibiotics to combat each threat. Dangerous bacteria. Acinetobacter baumannii. This is perhaps the most resistant bacteria at this time. Thousands die each year due to this bacteria. After all, it creates antibodies that are resistant to drugs. It starts with aggressive pneumonia accompanied by a powerful urinary tract infection. As a result, finding drugs to fight this bacteria is a high priority in laboratories. Pseudomonas aeruginosa. The attacks from this pathogen are various. Because of this, they are sometimes difficult to identify. This dangerous bacteria is related to patients with AIDS and fibrous cysts. In addition, it also can begin with a simple dermatitis or by ingesting contaminated water. In general, its grave danger is in its capacity to reproduce in people who have AIDS. At the same time, this tends to cause pulmonary complications and strong infections for persons who are compromised with another virus. Enterobacteriaceae. This bacteria is in a family of microorganisms whose diseases basically affect the digestive and excretory system. Generally, the colon, the stomach, and the intestines are the organs that are most compromised by these pathogens. In fact, this group of dangerous bacteria is responsible for infantile gastroenteritis, salmonella, typhoid fever, and dysentery. In the past, these diseases took a high number of lives during the time of plagues. Besides, many of these dangerous bacteria have a great resistance to penicillin. Enterococcus faecium. This bacteria coexists in the human intestines, but also can turn into a damaging agent. Enterococcus faecium is responsible for neonatal meningitis. This is an infection that causes headaches, a stiff neck, fever, and photophobia, a condition that causes pain in bright light. Currently, it has a high priority. Additionally, it presents a problem that is resistant to antibiotics. Most of the time, it is transmitted through a virus. Staphylococcus aureus. There are bacteria that can link to a group of infections and diseases in various organs of the human body. This is the case with Staphylococcus aureus. As a result, it is capable of causing problems in the skin and the respiratory and digestive systems. Consequently, this microorganism can cause these conditions, among others: conjunctivitis, cellulitis, sepsis, meningitis, pneumonia. In addition, the great majority of these infections occur in hospitals. Helicobacter pylori. This is a bacteria that attacks the stomach exclusively. In general, it infects the gastric mucus and generates bloating. It can cause gastritis, septic ulcer, irritated colon, lymphoma. In some cases, people contract this bacteria and have no symptoms throughout life. Saliva, feces and dental plaque transmit this bacteria. Campylobacter. In this case, we're talking about the major carrier of food poisoning in the world. These are the common symptoms that we find. Vomiting, fever, diarrhea, abdominal pain. Additionally, it can cause arthritis and Guillain-Barré disease. This is an bacterial agent. This can be perfectly eliminated with conventional antibiotics. However, it's also true that it is one of the most common and most dangerous bacteria. Especially important is that ingesting food or water that is contaminated, a virus, or contact with an infected animal can transmit Campylobacter. Salmonella. Salmonella is a form of Enterobacteriaceae. The incubation period is from 1 week to almost 1 month. Symptoms go from a fever to vomiting, diarrhea and stomach upset. After incubation, the symptoms could last up to 2 months in the worst cases. Salmonella can survive for long periods of time in foods such as butter, milk, and chocolate. Neisseria gonorrhoeae. Some dangerous infections are contagious by means of sexual contact. That is the case with this bacteria. As its name indicates, this microbe can cause gonorrhea. However, simple antibiotics such as ampicillin or penicillin can arrest this disease if detected in time.